Good afternoon, everyone, and welcome to our virtual health talk. My name is Melissa, and my pronouns are she, her, and hers. On behalf of the Patient Education and Engagement Program here at the University Health Network, I would like to thank you for attending today's session called Healthy Eating on a Budget. Before we get started, we'd like to share some information about the MyUHN patient portal. As you may have heard, UHN is preparing for a clinical transformation, launching a new health record system and patient portal on June 4th, 2022. If you're a current MyUHN patient portal user, there will be a few things that you need to do for a smooth transition to the new portal. The first is to sign into your MyUHN account between April 1st to June 3rd. Signing into your account during this period will make sure your email and password are transferred to the new patient portal. You can find more information about UHN's clinical transformation on uhn.ca, or please reach out to the patient portal support team by phone at 416-340-3777 or by email at myuhn@uhn.ca. Thanks, everyone. So now going back to our health talk, I would like to take a minute to thank our planning team, the Patient Education and Engagement Program, the Patient Learning and Experience Centers, and Education, Technology, and Media Services. Now, a few words about our online format. The session is being recorded and will be available for viewing with closed captioning at this same YouTube link afterwards. Today, we'll have a presentation for about 30 minutes, and then we'll open it up to the audience to ask questions for the rest of the session. If you have any questions about the live stream during the session, you can email us at pfbp@uhm.ca or leave a voicemail at 416-603-6290, and a member of our team will get back to you shortly. On the topic of technology, we realize anything can happen when it comes to the internet and our internet connections. So with that said, should my connection cut out at any point, hold tight, and you'll be seeing one of my amazing colleagues stepping in to facilitate the session. I also just wanted to note that some of our speakers are presenting on site at the hospital. So because of that, you may hear overhead announcements or alert codes in the background, in which case we'll pause for a few seconds until they're complete, and then we'll carry on. To submit your questions for the speakers, we invite you to go to the link on your screen. This link is also in the description box below. You can also scan the code using your smartphone's camera or QR code reader app, and you can submit questions anytime during the presentation. We want to thank those who have already submitted questions. It really helps us see what people are interested in learning about most. We have tried our best to address these within the presentation, but we'll definitely answer them again during the question and answer period. When you submit your questions, you might notice that it doesn't get posted right away. This is because we're now reviewing questions before they show up for the audience. This helps us make sure questions won't be repeated, and it gives us more time to address new and different questions. It can also help us see how we can prepare how to answer the questions before they're posted, so we can get you the best answer that you're looking for. We just ask you to please keep a few things in mind before you submit your question. So first, you can choose to include your name or stay anonymous, but please know that others will be able to see your name if you do include it. We ask that you do not include any personal details about your health or condition in your question. Our health talks are for general health information only, so the speakers are not here to diagnose or provide treatment recommendations. And we'll try to answer as many questions as we can during the question and answer period. And finally, you can also vote for your favorite questions by clicking the little thumbs up icon beside the question, and this will bring the question closer to the top and it'll more likely be answered. We're excited to also let you know that you can enter for a chance to win a $10 Tim Hortons gift card. To do so, you just have to fill out our feedback survey after the talk, and this draw will close in a week on Thursday, April 7th at 2:00 p.m. And on the following Friday, April 8th, we'll draw the name and notify the winner. So we ask that you please make sure to enter your email address correctly and to check your spam and junk folders next week if you're the winner. So now you're probably wondering, how do I fill out a feedback survey? So please go to the link on your screen and complete the survey at the end of the health talk. The link is also available in the description box below. Or again, you can scan the code using your smartphone's camera or QR code reader app, and it'll take you straight to the survey. After you complete the survey, you'll then see a link to the draw on the confirmation page. So we thank you in advance because your feedback will help us know what you liked, what we can improve on, and what topics you would like to see in the future. Okay, so now moving on to our presenters. So first we'll hear from Hadia Al-Tuwaiti, who immigrated to Canada with her husband from Yemen in 2017. Hadia is seen as a leader in her community. Hadia has a strong connection in the community where she lives, and she always is willing to help her community based on their needs. Hadia has been working at Community Matters since 2018. She handles many programs related to seniors, and she has a very good understanding about the diverse St. Jamestown community. Then we'll hear from Sarabi Kade, who immigrated to Canada in 2007. She holds a PhD degree in psychology from India. Shortly after arriving in Canada, she joined Community Matters Toronto, a neighborhood organization supporting newcomers in her St. Jamestown community, where she progressed from a volunteer to program manager to ultimately her present position as the organization's manager. Taking a community-based approach to the challenges faced by newcomers, Sarabi has successfully led her community through a variety of health, employment, and settlement programs and services. Most recently, she managed a 7-year project supported by the Public Health Agency of Canada, which developed mitigations to the extraordinary high levels of type 2 diabetes, cancer, and heart disease found in the Southeast Asian and African newcomer communities. Then we'll hear from Samantha Chabior, who is a registered dietitian in the cardiology and cardiovascular prevention and rehabilitation programs at the Toronto Western Hospital. She has been a dietitian at UHN for over 6 years, with experience working across many programs, including kidney transplant, dialysis, and head and neck cancer. She enjoys spending time creating heart-healthy recipes for her nutrition blog and getting outside for any outdoor adventure. So we have a great group of speakers today, and before we get started, I would like to take a moment to acknowledge the sacred land on which the University Health Network operates. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of the land and for thousands of years have cared for this land. We want to acknowledge and remind ourselves, and we encourage you to do the same too, wherever you're currently located, that we're still on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island. As we discuss healthy eating and accessing food over the next hour, I personally will be reflecting on how the land has given us the fruits, vegetables, and more that we'll be talking about. And we'll be thankful to this land for providing us with this harvest to nourish our body, mind, and spirit. This is another step I will take and invite you all to as well, to respect this privilege and recognize Indigenous peoples' beliefs, history, and as the original carers of this land. So for today's presentation, our presenters will be talking about many different topics. The first, we'll hear about what is food insecurity. We'll talk about what is the meaning of healthy food. We'll go over some tips on how to save money at the grocery store. And finally, we'll end off with some resources in the community where you can get more information and support. So now enough from me. I'll now turn it over to Hadia and Sarabi to get us started.
Hello, everybody. My name is Hadia. I'm an immigrant. I arrived Canada 2017, living in St. Jamestown. When I arrived Canada, I faced a lot of difficulties to secure healthy food with cheap prices. I was spending a lot of money beyond my budget, but after a while, I came to know from friends from Community Matters that there are flyers distributed by many supermarkets, which helped me to buy cheap vegetables and fruits. Now I am managing my grocery within limited budget. Also, I start to plant my herbs, vegetables, tomato, like onion, green, all this in my balconies. This helped me also to reduce my budget also. I'm preparing my own healthy food with different recipe, with a limit budget. With full confidence now, I'm sharing my experience to all newcomers. Thank you.
Thanks, Hadia. Hello, everyone. This is Surabhi Khare, and I just want to give a brief, just two line about the Community Matter, who we are. So, Community Matter is non-profit organization located in St. John's Town in Toronto, more than 20 years. We are grassroots organization, and we are not the only person who just create the program for the immigrant and for the people. We are just listen to the community what they are looking for. As we know, this area is a very dense area and all new immigrants, they are coming. So we are here to help them. Regarding the food security in Semjes town, it's a really big issue because those who are coming in a different community and different country, they are a bit confused because they have to settle in their life in this country and they are looking for the employment. So for them, it's not priority to go in the food store and see the healthy food, especially in this area. So they just want to looking for the job and how they are going to settle their life, how they are looking for the family. But when we are here and we have created, we listened to the community and we created so many programs based on the, healthy food. So we created a cross-cultural program with the diverse community. So diverse community, they are coming in a one group and they are sharing each other all the healthy recipe. We created tour with the food stores and then we said, okay, let's go and have a read the labels. So many countries, they don't have any idea, oh, they have to go to the store and they have to read the labels. So we created that program. So community, they learn how they have to read the label and how much they have to take a sugar and sodium. So it's kind of very, good and success program. We also realize in such a dense area, the people, they are living a very small apartment, how they can grow their own, herbs in the balcony. So we created a workshop over there and they learn and they created. So as you know, Hadia is the one person who created a beautiful balcony in summer and she has a lots of herb. So that's the things we are continuing to do it. And we are here to help them for the community, especially in this pandemic. It's really hit in our community. Those who are in the seniors people, they are scared to go to the visit. And mainly those who are still very healthy, but they are scared. They don't want to go. So we are just connected with two organizations where they are bringing a new and healthy food. We ask them what is where you are vegetarian, you are non-vegetarian, what is your situation, which kind of food you can take it. So we kind of customize the food and we deliver to them. So in the beginning, in the pandemic, we delivered door to door. We listen to the neighbors and we help them. But now they know exactly what we are doing. They are approaching to us. So our main goal is not is it a healthy eating for sure, but it's all the holistic approach, whether they are people, they are suffering the mental health and they are also not eating healthy food. So how we can come in one roof and we can promote each other in our community, and our community is become, it should be the become healthy community, and they learn how to eat healthy food and they have to live a healthy life. Thank you so much.
Wow, thank you so much, Hadia and Sarabi, for sharing your story, your experiences, your tips, but also your programs with us. It's really exciting to hear all the initiatives that your team has been doing and leading to not only support the St. Jamestown residents, but to empower them too. So that's really great to hear all you're doing to address food security in your community. Thank you so much for sharing with us. So now we'll turn it over to Samantha, who will provide us with some more information and tips before we move on to the question and answer period.
Good afternoon, everybody. Thank you, Melissa, for that introduction and for inviting me to present today about healthy eating on a budget. And thank you to Hadia and Sarabi for sharing your experiences and inspiring work. I really enjoyed listening to your presentations and feel there's so much that helps inform the slides that I'll be presenting. Next slide, thanks. Okay, so what is food insecurity? In general, it means that someone does not have enough money or is worried that they won't have enough money to buy enough food to prevent hunger, meet their nutrition needs, buy food at the grocery store, and instead they'll have to rely on food banks or charities or other means to access food. And I wanted to share this statistic from a study that looked at food insecurity in Canada. Before the pandemic, about 1 in 8 Canadians were experiencing food insecurity. And now, 2 years into the pandemic, unfortunately, we think this number is actually going up. And now that it's actually closer to 1 in 7 Canadians are experiencing food insecurity. And this number is actually much higher in certain parts of Canada, like Nunavut, for example. So unfortunately, this problem is actually getting worse instead of better. And so why is food insecurity a concern? Well, we know that people who experience food insecurity may also experience negative effects on their physical and mental health. They are at high risk of developing certain health conditions like heart disease, diabetes, and depression. And food insecurity also makes it hard to manage existing health conditions. So for example, someone might have to choose between buying medications or using that money to buy food instead. And at the end of the day, food insecurity is a result of not having enough money to buy safe and nutritious food. So increasing your grocery shopping and cooking skills, like we'll be talking about today, isn't going to necessarily solve this problem. Really, it's going to take much bigger policy changes like improving working wages, affordable housing, improving social assistance, and making sure affordable, nutritious food is easily available and accessible in every community. But hopefully with today's session, you'll leave with some ideas on how to help stretch your budget further at the grocery store and some additional resources you can take a look at as well. Next, we'll talk a bit about healthy eating and what it can mean to different people. And so today we'll talk about some general ideas about healthy eating, but I want to mention that healthy eating will look different for different cultures and different budgets. I think it's also important to acknowledge that many invisible barriers make healthy eating inaccessible for many people. So even though our talk is healthy eating on a budget, for many people, it might already be a challenge just to eat on a budget. And a lot of overprocessed or calorie-dense foods are more filling and satiating on tight budgets. So sometimes a meal that leaves you feeling full is going to be a priority over a meal that gives you enough vegetables, for example. And I'm sure there are some favorite foods that you've grown up with that you know and love. And it's important to know that a healthy diet doesn't mean giving up traditional foods, but rather thinking about what food choices make you feel good, feel satisfied, honor your culture and special traditions, and meet your unique nutrition needs. So with all that being said, I'd like to start off by introducing Canada's Food Guide, which is just one example of a way to get a variety of foods into your diet. I think for many people, it's a helpful starting point because it's very easy to think about your own plate and how it might look and compare to the way this plate looks. So Canada's Food Guide recommends filling half your plate with vegetables and fruits, a quarter plate with whole grains, a quarter plate with protein foods like meat, fish, chicken, eggs, and legumes, and making water your main drink of choice. And we'll be talking more about how to get more of these types of foods into your diet while eating on a budget throughout this presentation. I know for the people that I work with, some of my patients, maybe they don't eat from a plate, they use only bowls or large platters, and the Canada's Food Guide can still be adapted and used to help guide your overall food choices by using some general principles. As you can see here, that most of the plate is made up of foods that come from plants. So our fruits, vegetables, and grains are all foods that come from plants, and there's a lot of color and variety on the plate. And how can we save money at the grocery store? I know this is becoming even harder as food prices are going up. It's actually predicted that the average Canadian family of 4 will pay an extra $966 for food this year alone. That's a lot of money, especially if you're living on a tight budget. So trying to implement some of these strategies to save money will hopefully help you to stretch your dollar a little bit further. And I recommend starting with what you already have at home. And this will take a bit of planning, but I recommend that you start by taking an inventory or making a list of the food you already have at home. So start with your fridge because these foods usually go bad first. Then go through your pantry and your freezer and make a list of the foods you need to use up this week before they go bad. And then try and plan your meals around these foods to prevent food waste. And sometimes you can make a whole meal just with the foods you already have in your house. After you've made a list of what you have, you'll want to start to think about what you want to buy for this coming week. So before you make your grocery list, I recommend you try to take a look through the grocery store flyers for any good sales, especially on pricey items like meat, fish, and chicken. If you have a smartphone, there are apps that help you save some money and time, such as Flip and Reebee. And these apps show you all the grocery store flyers in your neighborhood. And then you can use these to price match foods if your grocery store does price matching. The next step is to plan a menu and make a grocery list for the week. If you don't usually make a menu or a meal plan for the week, then I recommend starting with just one meal that you want to focus on. You can choose whichever meal is the most challenging for you in terms of expenses and time. I would say for most people, this would be dinner. Eventually, you might become more comfortable with meal planning and begin thinking about planning out your breakfast, lunch, and dinner. When you're planning meals, try to choose recipes that use the same ingredients. So for example, if you buy a bag of sweet bell peppers and you only need 2 of them for a stir fry recipe, then think of ways to use those peppers up throughout the rest of the week, like making a chili or stuffed peppers, or even adding them to a morning breakfast omelet. It's often cheaper to buy ingredients in bulk, so large amounts, but then you might be left with large leftover amounts of that ingredient that can go bad. So a little bit of planning can really help prevent that additional food waste. And finally, one of the most important tips is to make a grocery list before you go shopping. This is very helpful because it prevents you from buying items you don't need or won't use. It also helps you save time in the grocery store because you know exactly what you're looking for. And once you actually get to the grocery store, there are a few ways you can also save some money. And one tip is to look at the very top and bottom shelves. So better value products tend to be on the upper and lower shelves away from where people might look first. You can also buy the no-name or generic store brands. These are often exactly the same product as the name brands, but cost a fraction of what the name brand costs. And lastly, check the unit price to compare products. And we'll talk about unit price and how to use that more on the next 2 slides. So many stores list the unit price next to the total price for most products. It will usually be listed as the cost per ounce or per gram or per 100 grams. And this saves you from having to do the math yourself to figure out if buying a larger size of the product is actually a better deal. So let's go through an example on unit pricing. And here we have 2 yogurts. Yogurt A, the one on the left, is a small 6-ounce container, and yogurt B, the one on the right, is a large 32-ounce container. If we just look at the total price, it looks like the smaller container is a better buy at 72 cents, compared to the cost of the larger container, which would be $1.62. But when we look at the unit price, which we see here in the green box, you can see we're paying 12 cents per ounce of yogurt for the small 6-ounce container and only 5 cents per ounce of yogurt for the larger container. And in this case, the unit price for the smaller container is more than double the price of the larger container. So we're actually getting more yogurt for a better price if we bought the larger yogurt. And many products are cheaper if you buy the larger version of them, but it's not always the case, especially if there's a sale on a smaller size of the product. It's also only a good buy if you have the space to store it and you'll actually be able to finish it. Otherwise, it will just end up going to waste. So let's move on to cooking and preparing food. It's often more affordable to buy the raw ingredients for a meal and prepare it yourself compared to buying a frozen or ready-made meal. So as often as you can, try to make your meals at home. Another great tip is to buy whole fruit and vegetables rather than the ones that have already been washed and chopped for you. For example, in the middle of these three pictures here, you can see a bundle of raw spinach, which costs $1.79, whereas a box of the pre-washed spinach is more than 3 times the cost for the same amount. It would only take a minute or so to wash the bundle of spinach yourself. But I'd also like to draw your attention to the yellow package of frozen spinach on the right-hand side of the screen. If you're looking for something more convenient, then frozen vegetables and fruit can actually be a great choice. They're just as nutritious as fresh and often the same price or cheaper compared to the fresh ones, but will last much longer. So it's great if you don't think you'll get through all of them, like all the spinach, for example, in a week. And if you live alone or find you can't get through certain foods fast enough, then knowing which foods you can freeze can be very helpful in reducing food waste. Any food with liquid or moisture will freeze really well, so things like soups, chilies, and stews. I recommend freezing leftovers for a quick, convenient meal on days you're in a rush or don't feel like cooking. And other foods like bread, milk, and raw proteins like meat, fish, and chicken freeze well and can last for months in your freezer. It can be helpful to stock up on expensive items when they're on sale, like the protein foods, and then freeze them to use later. So earlier in the presentation, I introduced the Canada's Food Guide as a good way to help you think about planning your meals. So we'll go through each section of the food guide, and I'll share some ways you can save money or stretch your dollar further. We'll start with eating more fruits and vegetables. If you can buy fruits and vegetables that are locally grown in Ontario, they tend to be a better price than imported produce. I find when produce is in season, meaning that it's currently in its growing season in Ontario, many fruits and vegetables will become more affordable compared to the imported produce. Fruits and vegetables that tend to be a good price year-round include carrots, cabbage, potatoes, onions, bananas, and apples. And oftentimes buying a bag of produce is a better unit price than buying them individually. So like a big bag of apples instead of one single apple. Another great option are frozen fruits and vegetables, which I previously mentioned, are just as nutritious as fresh fruits and vegetables, but can be a more convenient option. And good options for how to use your frozen veggies is to put them in soups, stir fries, omelets, or anything that requires cooking, as they can be a bit softer once you kind of heat them up. And frozen fruits are also great in smoothies or tossing into yogurt or cereal. And lastly, canned fruits and vegetables can be good options too. But if you're able to, then try to choose the canned veggies that say no salt added on them, or fruits that are canned in water or their own juices instead of syrups to reduce the amount of added sugar. For protein foods, they tend to be the biggest expense in our grocery budget. So finding them on sale might be the best option to save money. For poultry, if you buy a whole chicken, for example, or cuts of poultry with the skin and bones in, they tend to be a better price than the individual sections, like the chicken breasts that have the skin and bones already removed. By doing some of this work yourself, you can get some of these cuts at a more affordable price. And the prices of beef and pork do also vary based on the cuts. The lower fat cuts like stewing beef, for example, tend to be less tender, but they are also less expensive and can be made more tender by stewing them in a slow cooker or adding them to a soup or a chili. And fish can be quite expensive as well these days. So things like canned fish or frozen fillets can be a great option when fresh is too expensive. Another great option are eggs, nut butters, yogurt, kefir, cottage cheese. They're an overall good protein choice. They're convenient and easy to make and quite affordable when you compare them to the other protein choices. And they're versatile too, so you can use them for breakfast, lunch, or dinner. You can have a breakfast for dinner, for example, and use eggs as your protein in a quiche or just even adding them boiled. And my favorite affordable protein choice are the plant proteins. And these foods tend to come as some of the most affordable sources of protein compared to animal proteins. And these would be our beans, our chickpeas, lentils, tofu, edamame, and tempeh. Often a can of beans costs about $1, so it's definitely much more affordable than chicken, for example. And the last section of Canada's Food Guide recommends that we try to choose whole grains more often. So first of all, what is a whole grain? You can see a picture here on your screen, and it shows us a picture of a grain. And there are 3 parts to a grain. And the whole grain contains all 3 parts of this grain. So it keeps most of its health promoting nutrients like fiber intact, whereas refined grains have had 2 or more of the nutritious parts of the grain removed. And this doesn't mean that we can't eat refined grains, like white rice or white bread, for example. It just means that we should try to get in whole grains as often as our budget allows, so we get a bit more fiber and other nutrients. And grains are great to have in our diet in any form because they give us energy and can help fill us up and stretch our budget further. Some examples of whole grains are quinoa, barley, buckwheat, bulgur, and oats. Grains tend to be a good buy as far as price goes, but buying larger bags of grains or choosing the unprocessed grains, meaning you have to cook them yourself and add your own flavors, can save you even more money. For example, instead of buying the small packages of flavored instant oatmeal, try to buy the large bags of unflavored oats and add the flavor yourself through fruit or other ingredients. And instead of, those small instant flavored rice packets, try to buy the large bags of rice instead. So this is just one example of a meal you could put together, and it actually is a recipe pulled from budgetbites.com. We have egg for our protein. We have frozen mixed vegetables for our veggies and rice. Here they use white rice, but you could use brown rice too if you wanted to make it a whole grain. And so we have all 3 components of Canada's Food Guide. And on this website, they actually break down the cost or the estimated cost of the meal. So here for 1 bowl or 1 serving, it'd be $1.29. And so we've covered quite a lot of information today. So there are some potential ideas on the slide to help get you started, and you can try them out if you're feeling a bit overwhelmed. I usually encourage people to set just 1 or 2 goals that they want to work on for this week. So for example, your goal for the week might be to make a grocery list before you go grocery shopping, if that's not something that you currently already do. And lastly, I'll briefly share some resources that you can go to for more information and support. So this is a really wonderful resource, 211. You can either call 211 or that number on the screen, or go to their website as well. And they provide different options. A lot of actually resources are available on their website, but different low-cost food options, food banks and meal programs in your area. So they're a really great resource for support throughout all of Ontario. And this is also a wonderful resource. So it's Food Banks Canada, and you can actually take your smartphone, if you have that, and open up your camera and scan that QR code or that little box there, or go to their website, and it actually will open up a map and show you all the different food banks that are closest to your location. So you just put in your postal code. So that's a really great resource if you are looking for a food bank in your area, or if you have a client or a patient that would be looking for a food bank in their area. And perhaps something that has become, I think many people have become quite familiar with, is the Good Food Box from FoodShare. They actually deliver boxes of produce and other various very fresh, locally grown, diverse produce, and they deliver them straight to your door. It's available across all of Toronto and parts of Mississauga. So on their website, you can just click that. You could go to that link and look for their Good Food Box. And I think a large box of produce is about $25 or so. So that can be a really nice option as well. And I really do love this organization as well, Feed It Forward. They're a Toronto not-for-profit organization, and they say their 2 main goals are to feed Canadians that are food insecure and reduce food waste. They actually have a pay-what-you-can grocery store, bakery, and cafe in Toronto. So they have these suggested kind of point system for what would be a suggested price for an item, and then people are able to just go there and pay whatever they're able to. And they also have a map of community fridges where you can access free food. So anybody that needs free food or that is looking for food is able to go there and access that. And you can check out their website at feeditforward.ca. And lastly, this website, I already did show you one recipe, the egg and rice recipe from this website. It's budgetbites.com. And they do show a variety of different budget-friendly recipes, and they list the total price for the entire recipe or estimated cost, because obviously, food prices might vary based on your area. And then they break it down to what one serving might cost as well. So that's a really nice resource if you wanted to get some different ideas of some delicious recipes for various budgets. And if you still can't find what you're looking for, if there are other resources that you want to learn more about, then you can always contact the Patient and Family Learning Centers at UHN. They offer reliable and up-to-date health information to patients, families, healthcare providers, and members of the public. All of their services are free and available in multiple languages. Thank you so much for having me, and I look forward to any questions.
Thank you so much, Samantha. So that brings us to the end of the presentation component of our health talk. So on behalf of our participants and the patient education program, thank you so much, Hadia, Surabi, and Samantha for sharing your expertise and experience about healthy eating on a budget. So we'll now check out the Slido to see what questions have been submitted. You can still submit questions if you haven't already. Oops. To submit questions, please go to slido.com and enter UHN Health Talk in the event code. You can also scan the code using your smartphone's camera or QR code reader app, and it'll take you straight to the page. As a friendly reminder, you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. We also ask you to just please remember to not include any personal details about your health or condition in your question. The questions will be reviewed before they're posted to make sure they're relevant to the topic. And sometimes we may also rephrase questions to help clarify them for the speakers. But if we haven't covered your question fully, please feel free to email us afterwards and we'll get some more information for you. Okay, so starting from the top, the first question asks, what are some affordable foods that are fast to prepare and keep you full longer?
So I'm happy to start off for this one. I think, personally, I love any of the canned beans, chickpeas, or lentils. When you buy them canned, they're already ready to go. So that means you don't even really have to cook them. You can just eat them straight out of the can. You can just give them a little rinse. I recommend running them under some cold running water, and then you can toss them into pretty much anything that you have ingredients for that's available. So if you wanted to make a salad, you could toss them into that. If you want to make a curry or a stew, you can toss them into that. Great for pastas. They're so versatile. And because they're already cooked and ready to go, that really does cut down on the cooking time. Plus, they're so rich in fiber. So that's going to definitely help sustain you and keep you feeling fuller for longer. So personally, that is definitely one of my favorite go-tos that I think they're on the more affordable side as far as our proteins go. So they give us some protein too, and they give us that fiber, which gives us that long-lasting feeling of fullness. So I also think that Budget Bites website is great for different, recipes. If you're looking for different recipes, they have, breakfast, lunch, dinner, snacks. You can, definitely browse through there. But I would say my top favorite one is definitely the canned legumes or beans. Tofu is also really great. It can be eaten raw or you can cook it up. And it's also, because it's, ready to go, it doesn't take a long time to cook, and it's a great source of protein as well.
Thank you so much, Samantha. Okay, so our next question. So somebody has asked, do you have any savings tips for people who need gluten-free food? And they've kindly provided a tip for others. So the Canada Revenue Agency does allow the price differential via medical expense claims with detailed information about this on the Canadian Celiac Association website. And these are for people with biopsy confirmed celiac only. So yes, if whoever submitted this question, thank you for your question and for the tip.
Yeah, thank you for that question and amazing tip too to help make others aware. So for sure, you know, if you are someone that does require a gluten-free diet, then those, you know, gluten-free specific products, you can submit that and kind of use it as towards the tax credit. So I would say that gluten-free products in general, especially now with it becoming more of a popular kind of diet in itself, they have become quite expensive. But on the other hand, too, it's great because there's more variety. So that's amazing for people that do have celiac disease or require gluten-free products. I think probably what I would say, you know, in terms of looking for gluten-free products, I would say try and look for ones that are naturally gluten-free to begin with, so that you're not paying for that extra kind of marketing, so to speak. I think that would be probably, you know, there's a lot of foods that are already naturally gluten-free. Of course, you know, making sure you read the food labels to make sure that there isn't any potential risk of contamination there. So looking for mostly those naturally gluten-free products, like if you're looking for grains, you know, for example, rice, you know, that would be, you know, an affordable gluten-free product. As well as a variety of other, you know, our fruits, our veggies, our legumes, they're going to be naturally gluten-free. So looking for those products, because I agree, you know, sometimes it can be quite pricey. The other option, you know, would just be trying to find when they're on sale, and then, you know, maybe if you do have the budget available, to stock up on a few items at that time. Also, just in general, if you do have a specific medical condition, if you're on Ontario Disability Support Program on ODSP, you can actually ask your caseworker to submit a special diet allowance form for you, and that can help provide a little bit of extra money towards food for various medical conditions. So I always encourage people, you know, not everybody unfortunately is aware of that as an option. I think it's really, you know, it's a little bit of extra money, but it can definitely be helpful for sure.
Thank you so much, Samantha, for that tip as well, too. That's good to know. Okay, so our next question. Somebody has asked, are canned, frozen, and fresh vegetables equally nutritious? So I think, Samantha, you touched on this a little bit during your presentation. I don't know if you would like to summarize again and add to that.
Yeah, and thanks for that question. It's such a common question, and I think it's, you know, we can't emphasize it enough that yes, absolutely, canned, frozen, and fresh vegetables are all equally nutritious. You know, with the canned ones, they do get a little bit of a bad reputation because, you know, canned foods can be higher in sodium or sugar, but there are lots of options that, you know, especially if you look for canned veggies that say no salt added on them, that's a wonderful choice. You can find like canned tomatoes, canned beans that have no salt added to kind of help preserve them. And the frozen veggies and vegetables, they're actually picked at their peak freshness. So right on the farm, they're taken to the plant, processed, and frozen right at their peak freshness. That means that nutrition's locked in there. So that's actually a really nice benefit too. And they're often affordable and really convenient because, you know, a lot of times they're already, you know, washed and chopped for you. So you can just toss them into something, and that can really help save some time as well. So
Thank you so much. I didn't know that about the peak freshness, so that's helpful for me to know too. Thank you. Okay. So our next question, I see we have 2 more questions. So just a reminder that please, you're welcome to continue to submit questions by going to the link and scanning the code on your screen. So somebody has said, I have diabetes and other health problems and want more information on what to avoid. Where can I get this information? So maybe we can start with maybe some general tips of things to avoid, but also where to get some more resources.
Yeah, for sure. I think that, everyone's needs are going to be very unique and different. And I think it depends on what you already have access to at present. So if you are a patient at UHN, if you are able to get a referral to a dietitian or a referral to dietitian in the community, dietitians at UHN or within public healthcare settings will be free of cost. So you can definitely get some great information there. Asking your family doctor for a referral if they do work with any dietitians in the community is also excellent. I think that in general, a wonderful website would be www.diabetescanada.ca, and they have tons of great resources and lots of really nice handouts that you can download and resources that you can read. Also, if you search for Dietitians of Canada or dietitians.ca, you can get lots of great resources there. If you're able to, get a referral to a dietitian, I think that's really nice to get that one-on-one support. Or if your work does cover, some insurance plans do cover nutrition counseling from a dietitian, you can also request that, or you can try and submit your expenses for reimbursement that way. So I would say that a great place to start would be Diabetes Canada and Dietitians of Canada, those websites. And then if you can get the resources and access to a dietitian, that's also really nice. And also sometimes, talking to your family doctor, they can help get you started as well.
Thank you so much, Samantha. So Ravi and Hadi, I don't mean to put you on the spot, but I wondered too, if there are any community resources that could help somebody with diabetes that you've learned of in the St. Jamestown community.
So I think, yes, we are connected with the Region Community Health Center, and we created a mini program regarding, diabetes, because especially the South Asians, they have a very common problem with the diabetes. So when we are connected with them, so the dietitian and nurse, they are coming and running the workshop, and they are also teaching about the Canada Food Guide and food service, like serving how much you have to eat. And regarding that, we created a mini cross-cultural program as well, where the people, they just want to eat their own food, but how they can stay with the healthy food. So they are bringing their own cultural food, and we created actually the different kind of recipe, those who indicate a healthy food. So that this kind of program we are created, and still we are running a mini program based on healthy eating and healthy lifestyle. So we are connected with Region Community Health Center, so dietitian and nurse, they are coming and they are teaching to promote the healthy eating program. Thank you.
Thank you so much. Thank you, Ravi and Samantha, for all those resources. You mentioned the community health centers, which also is a really great support too. Thank you.
I just wanted to also, as you're talking, I was just thinking, we have diabetes education programs too, that if you search, even if you just Google diabetes education programs Toronto, there are free programs that are, OHIP's not required. They're often in multiple languages. So also really potentially good resource if you wanted to search in there. Some of them you don't even need a referral from any providers. You can just self-refer, and they have these types of also great resources too, where there's looking at the whole person to healthy eating, activity, stress management. So could be a really good resource as well.
That's wonderful. That sounds great. And again, like the UHN patient libraries are also here to help you find resources too, if you need help with that. Great, thank you all. Okay, so let's see. Oh, it looks like we have quite a few more questions, which is great. So the next question asks, what types of programming at the community level do you think are most helpful to support people who are food insecure? So this sounds like a question for Ravi and Hadia. Would you like to start with that?
This is a really great question, and thanks for this question. Yes, as I mentioned earlier, in this community, many people, they are coming in a very diverse community, and for them, it's a big challenge. But we are listening to the community, and based on the community, we are creating the program like healthy eating, cross-cultural food, and especially what we realize in this community, people are in hurry and they are going in the grocery, and whatever they are just thinking they have to cook and prepare today, they are just grabbing that food. So we are always telling to them, just do the smart cooking. And if you have a smart cooking and smart grocery shopping as well, so if you have any problem and any difficulties, we are, as a community member, we can help them, we can walk with you guys. And especially in our community, in all our own community assistant, based on the language barrier, we always hire in a different language, so at least they can fill that gap. So we always make a buddy, so they can go in the grocery store in the first stage and they can learn how they can read the label, how can buy the smart shopping. And also we encourage them to read the flyers, because those this time, like, people, they are using a lots of smartphone, so they can, upload that app, and when they are getting it every week, so they can go over there and they can see, and they can, store the food according to their what they are going to prepare. So this kind of, we do a lot in the community, and we are always open as the things are. If the program is not here, especially in the pandemic, the people, they message us, they call us, they email us, and we are here to support them. So that is the way we are supporting in our community.
Thank you
Thank
so
you.
much, Surabhi. Lots of great community supports going on in the St. Jamestown area. Awesome. I love what you said about the buddy program too. I think that's really smart.
Thank you.
Okay, so the next question. Somebody has asked, are automatic food composters okay to use to help with the small vegetable space? The review I saw of one, although it's expensive, looks like it is difficult to feed the machine because it is slowed by sugary foods and is high maintenance. I thought it would pay for itself in the end.
It's a great question, to be honest. I'm not 100% certain I know the answer to this one. I'm not sure if anyone else wants to chime in if they do. Not very familiar with the automatic food composters. I think I've seen, one of them being marketed. I think if you have the space, if you have a backyard or space to get just, a compost bin, perhaps you don't have a lot of space and that's why you're thinking of like the more compact ones. I think that would probably be, a pretty affordable way of doing it. I know I think City of Toronto as well does it, but I know certain regions, they also do provide free compost at the start of the season. So if you're looking for, to get compost, to do some gardening, then I do believe that you can get some of that as well. I'm not 100% certain. I can definitely look into that. And unfortunately, I'm not too sure about the maintenance and the use of it, but if anyone else does know, then feel free to chime in.
Thank you, Samantha. Unfortunately, I don't, but thank you for offering to look into this some more. So whoever submitted this question, if you'd like to email us so that then we can contact you and get some more information for you, that would be great. But thank you, Samantha. Okay, so the next question, so somebody has asked, can I see the presentation with the 211 information? So yes, of course. So I can go back to that slide really quickly so that then you can take a look at the information. Sorry, give me just 1 second to find it in our deck. So it's the one that Samantha had mentioned. So their number is, you can just call 211 if you're in Ontario, or the 416-392-6655 number. And they also have a website, so www.211ontario.ca. And if you'd like, you can even pause the YouTube video and then jot it down as well. And then it'll all record afterwards, whatever you miss later on. Okay, I'm going to go back to the Slido now. Okay, so the next question, let's talk snacks. So what are some healthy snacks other than nuts and fruit that we can try?
I can start off and then perhaps if anyone else wants to chime in. So I think that it really depends what you enjoy. If you like kind of crunchy things, I love air pop popcorn, and that's also kind of a nice affordable choice too. You can buy just the corn kernels and pop them yourself in a pot. You don't even need any fancy kind of equipment for it. So that's always a really nice kind of fun, crunchy snack. I think that things like peanut butter are also amazing. I can get a bit of protein and fiber, filling, tasty, can definitely be versatile too. If you like cottage cheese, I think it really depends on, what your own nutrition needs are, what your preferences are, what your budget is. So tons of variety, but you're right, nuts and fruit, great options, but perhaps Hadi and Sarabi want to, jump into and let us know what kind of snacks you think are great. I'm happy to hear.
Thank you, Samantha. Actually, this is all depend on the people, but definitely we also learning from different culture to different culture, and we learn many people, they are like especially South Indian people, they are making kind of very healthy. It's called poha. So it's a very tasty. It's mix of with the rice flakes and mix of the peas. So it's lots of green vegetable over there and very less oil. So that is the thing we learn, and it's depend on what you really like. We always tell them, please avoid the oil, because many culture they have the things for, if they are thinking of the snack, it should be the deep fry. So we always tell them, please avoid the oil. Otherwise, it's the same thing. Whatever you have mood, definitely you can also go and YouTube and learn healthy food as well. The same thing we are also doing it here. But yeah, this is my answer. Thank you.
Thank you. Thank you, Sarabi and Samantha. I think you've given everyone some more ideas of different snacks they can try. Okay. So the next question, very often I see halal type food and wonder if this is more expensive. So maybe we can start by describing what halal food is or halal type food is for people who may not be familiar, and then we can answer this question.
I can for sure, take a stab for sure. So halal type food, and that would just be a way that the food is prepared. So I think that in the sense of it being more expensive, I think that it's going to depend perhaps on what the product is. I know you can find like halal chicken, for example, there's yogurts. And I think that it's going to depend on perhaps the actual provider of the food as to, whether it's going to be more expensive than just, conventional poultry or dairy. Sometimes I have seen them actually at a more affordable price. So I would say that if you do follow a halal diet, then, you can obviously continue to choose those foods. And if you don't, then and they're, perhaps on sale that day, or, at a better price point than the conventional foods, then that can always be a great option too. There's, whichever one you choose is going to be a good option. And yeah, I think, wondering if it is more expensive, I think it would just really depend on that particular specific product and the provider. I'm not sure if that answers the question, but
I think maybe Hadia can say something.
Yeah. This is the problem. Our problem is we cannot get halal, most of the newcomers and Muslim community, because it's very expensive. And that's why we are just going here and there just to see a cheaper price if possible. If not that, we are not going to buy especially the chicken and the meat. We cannot buy without, if it is halal, then we can buy it. The problem that it is very expensive. Sometimes it is on sale. Whenever it's on sale, that people they are buying that. But nowadays, I think there is halal stores open, most of them. I think it is better than previous. It's a religion thing, that is slaughtering, that it is halal or not.
Thank you so much, Hadia and Samantha. And you're totally right, Hadia. I've seen a lot more halal grocery stores now too, which is really great to see. Awesome. So unfortunately, as I'm keeping an eye on the time, it's already 1:59 p.m. So unfortunately, we'll have to wrap up our health talk for today. Oops, sorry, 1 second. Okay. Oh my goodness, sorry. I'm having technical difficulties on my end today. But so thank you everyone for submitting your questions. And thank you so much, Samantha, Hadia, and Sarabi for presenting and sharing your tips, your awesome tips, and also your experiences and helping us learn a bit more about healthy eating on a budget today, or even just eating on a budget today. So if we didn't get a chance to answer your question, please email us at pfvp@uhn.ca and we'll try to get an answer for you within 1 week. And your feedback is really important to us, so please go to the link on your screen and complete the survey, or you can scan the code using your smartphone's camera or QR code reader app and it'll take you to the survey. And you'll also be able to enter a chance to win a $10 Tim Hortons gift card if you do fill one out. So again, that link to enter the draw will be in the confirmation page of your completed survey. The draw will close in a week, so on Thursday, April 7th at 2 o'clock, and we'll draw the name and notify the winner on Friday, April 8th. So yes, that you please make sure to enter your email address correctly so we can make sure we're contacting the right address, and to also check your spam and junk folders for our reply. And to find out about our next talk, you can subscribe to our online patient e-newsletter and get up-to-date information about our events and new resources at UHN. And to fill out a form to subscribe, you can go to the link on your screen. This link is also available in the confirmation page of your feedback survey if you're filling that out right now. So thank you again, everyone, for attending, and we hope to see you at our next talk in April.